Hello everyone, my name is Charity and here I'm from Humans Global. I will be presenting two cases of patients with mental health disorder, and I will also be talking about their treatment costs and the use of ATIVAN. ATIVAN is a benzodiazepam that is widely used for the management of anxiety and depression. LORAZEPAM is federal FDA approved for short-term relief of anxiety symptoms related to anxiety disorder. It works by affecting the brain and central nervous system to produce a sedative effect. It also works by enhancing the effect of certain um, natural chemicals in the body. It also has side effects. These side effects include, but not limited to, confusion, lack of muscle control, tremors, overdose, addiction, drowsiness, loss of balance, or coordination. My case one is a patient of 46-year-old female, African American female. Her complaint was that she feels anxious and depressed. Her medication, home medication, she's using Zoloft, Celexa, and melatonin at home. She denies any substance abuse. Her history shows that she has suicidal ideation, poor concentration, anxiety, and depression. She has known allergies. Her father is an alcohol and drug abuse. She smokes cigarettes. She admitted she smoked cigarettes. Her diagnostic test was CT scan. Mental status exam shows that she has anxiety and depression. No liability and no assets and liability. Physical exam shows that this patient is alert and oriented, well nourished, and well groomed. Further explaining more about this patient, he is a 46-year-old African American admitted with worsening anxiety and depression. Before her admission, she had expressed intention of taking her life or harming herself because her boyfriend of many years left her for another woman, and this triggered her anxiety and depression. She has also a history of anxiety, insomnia, depression, and has thought of killing herself. She is on one-on-one nursing at this time in the hospital. She has a 12-year-old daughter who is retarded. She has been receiving ECT treatment weeks in the community before she was admitted. In the hospital, she was started with Diloxetine and ATIVAN. Patient will continue with the current medication that she has been on. Patient will also continue on one-on-one watch. When patient is stabilized, he will be some of the medications will be discontinued. Patient will continue with the ECT therapy when discharged. This patient will continue to be monitored. Patient will be discharged with ATIVAN, melatonin, and Zoloft. ATIVAN of 5 milligram as to be taken at bedtime as needed. This analysis. After the initial psychiatric assessment of this patient's case, the previously used medication did not manage the current condition well. ATIVAN can treat severe anxiety and depression that the other medication failed to treat. Brief psychotic rating scale show that this patient is diagnosed with anxiety. And ATIVAN can also be used in the reduction of current suicidal thoughts, as it helps in restoring the balance of neurotransmitters in the brain. This is case 2. Case 2 was brought in because he stabbed a friend with a small kitchen knife. He was diagnosed with schizophrenia. His current medication because he has other comorbidities. He is on metoprolol, metformin, Seroquel, and Lipitor. Past medication history include hypertension, CHF, DM, that's diabetes mellitus, hyperlipidemia, asthma, glaucoma, COPD, obesity, and schizophrenia. Patient endorses drinking alcohol and taking drugs. Patient lives alone. No, doesn't associate with friends and family that much. Family history revealed that the father is schizophrenic, has diabetes and hypertension, and mother is legally blind, has diabetes, hypertension, and has breast cancer. No known allergies were noted. Diagnosis test, brief psychotic rating scale was used, and this patient scored 30. Assets and liability is none. Patient looks good, looks alert, oriented, paranoid though, and well kept. Jane is a 49-year-old African American male. He was diagnosed with adolescent onset of schizophrenia and auditory hallucination at the age of 14, and had a medical diagnosis of significant clinical depression with psychotic function. He was reported with violent behavior, alcohol, and other substances abuse, and has been in jail several times. Throughout his hospitalization, Jones was reported for non-compliance with care and medication, and verbally abusive to staff members. Ms. Jones was started on clozapine and Haldol. His condition improved, and he was having fewer behavior issues. Now, his medication was titrated down, and he has been discharged with clozapine 12.5 mg to be taken daily. Case analysis. Brief psychotic rating scale was used to diagnose this patient as having schizophrenia. This patient medication history shows a series of contraindications to ATIVAN, CHF, hypertension, diabetes, asthma, glaucoma, and COPD. This shows that we cannot use ATIVAN for this patient. Cultural and diversity effects. Cultural differences can be frustrating for both um, patients and healthcare professionals. Culture is vital in this decision making about which medication to offer a patient. Cultural diversity means requirements such as ability, age, idea, and belief to guarantee efficiency of functioning within the patient's social context. In both studies, the two patients believe that using a sedative medication is a sign of worsening symptoms. So when prescribing this medication, it is crucial for the prescriber to explain the reasons behind every medication that could sedate a patient. Conclusion. Evidence-based medication is a systematic approach to clinical problem solving that gives a framework to use evidence to support clinical practice. It assists the medical professionals in choosing the proper treatment. ATIVAN is contraindicated in patients with heart disease and diabetes. ATIVAN enhances GABA inhibitory effects and reduces anxiety, including panic attacks, agitation, and restlessness. ATIVAN can cause severe respiratory distress, renal dysfunction, hypotension, and even death. These are my references. Thank you for listening.